History laid the foundation
that informs our conversation. Welcome to the classroom.
From the church to the streets, and even in the suites, and all around the world. I'm gonna keep it real in the classroom. Fannie Lou's classroom. Fannie Lou's classroom. Fannie Lou's classroom.
Good afternoon and welcome back to another episode of Fannie Lou's Classroom. And I say it every week, but we have an amazing conversation that we have lined up for today with some powerful guests. And we're going to have an important conversation around a topic that is not discussed often or enough or gets enough attention. And we want to make sure that we, in the spirit of Fannie Lou Hamer, one who I think will be deserving to be centered in this conversation as well, as we talk about Black maternal health. But the first, you know what I have to do? I have to shout out the team. Got to shout out Brooke Mosley, who holds it down every week, our audio engineer. And then, of course, we have to shout out Cheryl and Shanique for making sure we're prepped and ready to go from week to week. And so Cheryl, you know, she never likes to be on camera. One day I'm going to catch on camera doing her dance with her shoulders because she likes to clown off camera. So we want to thank our team. I really do thank our team for making this happen week after week. A lot of work goes into making sure we're prepped and ready to go. But what I have to first start off by doing is shouting out Coach Don Staley and the South Carolina Gamecocks women's team for winning the championship. Not just winning the championship, but going undefeated in a rebuilding year. Okay, all 5 of your starters leave, and this black girl magic, black woman magic came back and did it. And also, I'm going a little bit off script because it just hit me. As they won, as I looked at, Twitter, X, whatever you want to call it, I boycott from here and there when it comes to that. Instagram, everywhere I look, particularly I'm talking about black Instagram pages. So they're congratulating the South Carolina young ladies on the victory. And when you go straight to the comments, all I see is Caitlin Clark is this. Caitlin Clark. They're rendered invisible, the young black girls and Coach Staley, right? And I'm thinking, and these are black folk, and particularly black men. And so I thought about the fact that the conversation we're going to have on today around Black maternal health, this idea of the invisibilization of black women's bodies, right? Not even acknowledge. The headline says, congratulations, South Carolina. Right. But you all are talking about how great Caitlin Clark is, right? And I'm just like, let me get off social media. I can only talk to so many folks back and forth, right? But I think that's kind of where it starts, though, right? We talk about the issue of black maternal health, and we think about black women's bodies if we go from enslavement to the present day, right? Labor and production. One, it was how much cotton can you pick, how much tobacco can you chop, rice you can harvest, regardless of any attention to your well-being. Right. Birthing in the fields. You didn't get maternity leave, right? Whether you lived or if you died, or all the babies that were lost working in the field, or how much we can labor in production by way of birthing babies for sale, right? Or even if we were able to some kind of way find love with a man and have children, those children also can be snatched from us, and what that still mean for my maternal well-being. So I'm just looking at the ways, I'm like, this is, for me, it's all connected, and how we have to begin to start to see black women, right, as human. Right. And how we have to find what, is, because it's the ways I feel it's manifested. So when those same young black girls, they decide to, become mothers by giving birth, I mean, if you can't even see them as winning the championship, are you going to see them as, deserving of proper health care? And so it also made me think about not just the healthcare system, but also us. Do we see us as valuable? If I'm in your family, am I attending to your well-being, right? And we'll get to all that, but I just kind of want to set the stage for the conversation. I know we have some questions we'll get to, but this is kind of organic. And I thought about it when I was congratulating them, that I remembered what I did not hear from people. So am I even seeing you as human in my own community, in my own families, and making sure I'm not working you to death while you're pregnant? Expecting too much from you to do in the house while you're pregnant, right? And are we also saying, oh, she pregnant, she'll be all right, she just say she tired? we also need to look within our communities too. So that's what I wanted to kind of lean into, but I wanted to at least celebrate, Dawn and those young girls for a great achievements. So we'll definitely celebrate them and acknowledge them even when others do not.
Yeah.
So congratulations to them. So we have some amazing guests. Let me introduce our guests. I almost started throwing them questions without introducing them. I had to bring myself back. But I do think this is a great conversation we're going to have around Black maternal health and the well-being of Black women in our families. So first, we have Dr. Kyrah Brown. Her pronouns are she and her, is a community psychologist and health equity researcher. She works as an assistant professor of public health in the College of Nursing and Health Innovation at the University of Texas at Arlington. She established and leads the Maternal and Reproductive Health Equity Research Lab at UTA, which focuses on examining the social and structural determinants of reproductive and cardiovascular health inequities among women across the life course. She is passionate about partnering with community and leveraging research and elevation to aid in dismantling the racial and social inequities rooted in structural gendered racism that impact Black people. Her work in this space is not only driven by personal experience, but is grounded in Ubuntu. Yes, a belief in collective personhood, a collective responsibility to assure optimal health and quality of life for everyone. Dr. Brown is a proud alumni of Spelman College, earned her doctorate at Wichita State University, and completed her academic public health postdoctoral fellowship at Sedgwick County Health Department. Is that Kentucky?
Kansas.
Okay, Kansas School of Medicine, Wichita. Welcome to the show, Dr. Kyrah Brown.
Thank you so much.
Then we have Misty Wilder. Misty is the program director of the UNT Health Science Center Healthy Start program, the largest fairly funded program addressing infant and maternal health in the United States. She is also the Health Equity Alliance, formerly the Infant Health Network past immediate chair. I got to read that again. Wait a minute. She's also the Health Equity Alliance, formerly the Infant Health Network past immediate chair. Her vast knowledge and experience has been focused on partnering with community-based services, organizations, the faith leaders to improve the health and well-being of women and their families. Misty serves on numerous local, state, and national boards, including the African American Health Expo. Misty is the founder and CEO of Celebrate She, an organization that celebrates, educates, and inspires women and young girls. She holds a master's in social work from the University of Texas at Arlington. Welcome, Misty Wilder. Welcome both, all this brilliance in the room that is partnered with faith and is partnered with community. And that's what this show is about, right? Family's Classroom, that intersection of politics, faith, and race. And so let's just kind of jump right in.
Okay.
So, did you all want to say anything before we jump right in?
No.
Okay.
We're
just happy to be here.
Oh. Yeah.
We are super glad to have you. And I think this is just reading your bios. I say this all the time when I know what people do. When I read their bios, then I have a whole nother set of questions. But I'm going to hold those because I think what you all bring to the table, right, needs to be celebrated and elevated. Because what you do, Dr. Brown, this idea of data, because oftentimes we don't have that information readily available to us, but we know it's happening. And I think that's so important for us to be able to look and have data, because we know the bodies that are attached to the data.
Right.
But it's also really good for us, and I'm going to be reaching out to you very soon.
Okay.
I'm going to need some data for this this dissertation I'm writing. So I'll need that good research. And then, Misty, for you, right, I think what I got from you when I did you had me come out to Fort Worth and do something with you, and I just felt, I think it's good that you reached out to faith communities, right? Because so often, I say this all the time, that the academy and the church and the community is such a disconnect. And I think to really get where we're trying to go, we have to make that gap come all the way in. We have to really see how we inform one another. Right. So we have to have the academy. We have to also have what I call the practical theologians working, like what's happening today between Sundays and how do we address that, but partner with those of you who have the experience. And I always say, I don't need to know how to do it. I know Misty. I know Dr. And same thing, right? And I think we work better when we know what we're called to, walking in that purpose, right? Then we know how to work collectively. In your bio, collective responsibility, Ubuntu, that's what that's about, right? And so I just appreciate this. I just wanted to say that before we got started, because I want people to know that's the importance of this conversation, that we have to do this together.
Right.
In order to make a dent. But today we're going to focus on specifically Black women and their maternal health is the conversation for today. So just so people know this baseline level, what are, before we get to the rates, let's talk, what is Black maternal health and what is Black maternal mortality and morbidity, so people can know the difference.
Yeah. So, so when we're talking about Black maternal mortality, there's some specific terms like you may see pregnancy-related deaths or pregnancy-associated deaths, and I think at the very base level, for us to understand Black maternal death, we're talking about the death that is related to some complication that's been aggravated or exacerbated by that pregnancy or a condition related to pregnancy, and a death that occurs up to a year after childbirth. And so that up to a year is really important. And when we get into kind of the details, we'll see kind of how much of, the deaths happen after delivery, after you've made it home.
Yeah. So Dr. Brown, what you're saying and going to say is so important. Pull your mic up just a little bit, because you're kind of going in and out there.
Okay, sorry about that. Okay, is that better?
Oh, yeah, yes.
Okay.
Yeah, we don't want to miss anything.
Okay.
Did you want to add anything, Misty?
No, I think Dr. Brown said it well.
Okay. So I just want everybody to kind of know when we say those words, what we mean by that, so they're clear about that. So, okay, so can you talk about, maybe one of you can talk about, what are the rates? So let's talk about statistically, what does that really mean and what does that look like?
Yeah.
It doesn't matter.
Okay, sure. I'll jump
We know
in.
we both know it.
Yeah. I don't want to hog the mic.
I'm coming to you next.
Okay.
It's okay. We in this thing together.
Yes, we are.
I hear your voice.
That's my favorite Misty saying.
Yes.
So this is always an interesting when I think about like that question. So we know like at the national level, like we have some very recent data that tells us, like at least as recent as 2021, what our rates are. And I took a note here because I don't want to rely on my memory, but for our national rates in 2021, the Black maternal mortality rate was 69.9 per 100,000 live births. And that's compared to other racial groups, and I often don't like to compare to white births, but I think that's an indication of like the inequity that exists. So among white birthing people is 26.6. So that's 3 to 4 times higher.
Right.
And our Texas rates are very similar to that. However, here in Texas, our data are just a little bit more behind. So the recent maternal mortality and morbidity review committee report that came out, it was a 2022 report, but the data was like 2013. And so,
Oh, wow.
yeah, so it's a little bit behind, and that's a whole nother conversation. But the rates for Texas that they reported for Black women was 47.6. Deaths per 100,000 live births, whereas for non-Hispanic white women, it was 20.3 deaths, and then Hispanic was 10.8. So again, we're seeing a double the rate for Black women and birthing people in Texas.
Wow. Okay. It's not to say there that we have the national numbers, but the fact that we're going off of 2013 numbers. So I'm going to jump around here because I want to now, because you said that, I know, well, tell me what statewide, is there a board that is in place that is responsible for tracking this data?
Yes. So the Maternal Mortality and Morbidity Review Committee, they used to be a task force committee now, and they are responsible for convening and reviewing those cases and identifying the contributing factors, what percent of those were potentially preventable, what were the preventable factors involved, and they meet regularly, but the report for Texas is released every other year, every 2 years.
Every other year? Is it coinciding with the legislative session, or it's just every other year, no relation?
I'm not sure about that.
No, because I think it will be released coming up this September. So it's
Okay.
usually in September.
Okay. Okay. So then why do we only have 2013?
So, I'll just answer from my perspective.
Yes.
And especially from the surveillance data perspective.
Right.
Naturally, it takes a while to compile data from death records and certificates, and to clean it and to properly categorize it, all of that. So that takes a while. But from a kind of structural standpoint, this is not just unique to Texas, but there has to be kind of an environment where there's policy that promotes timely kind of checkpoints, right? There are bureaucratic systems, there's processes and all of that. And so I think that when we see situations where data is lagging extra behind, there's something happening in terms of the bureaucratic makeup of the institution. And like I said, it's not unique to Texas, but that's a far ways behind, and it can impede, existing work. And we know that at the national level, COVID impacted the maternal death rate. We saw an increase there, but we can't see that yet in Texas on paper.
And also what we want to think about too, because on our campus at UNT Health Science Center, we do the redaction and for the cases. So we hold a grant that does that to prepare for the report. And it's not an easy feat. I mean, you have women with large medical records that we are going through, redacting that name out to de-identify it. It's not an easy. So I understand that the data is late, but that process is very time consuming, and it requires a lot of work and a lot of manpower to try to pull it, because we have to redact it, then we have to give it to another team, and they do what they do to give a report on some things that they saw, and then it goes to the review committee. So it's a lot of processes
that has to go through. Yeah. So well, then is it lag behind then, or is it more of a, like you said, policy driven, and also is it not having people, like the human capital to do? You understand what I'm trying to get at?
Yeah.
I'm trying to understand, is there a way to, this is 2020, we're halfway through 2024. So I'm just wondering, is there a way, I'm just asking, I just want, just for my own education to kind of know, is there something we can do by way of advocacy or something to push for, or is it just the way it is?
I think, and I'll let Misty speak to the part of, because I'm not as familiar with what happens before it gets to y'all, because I agree it is a process, because it's not only all of that, but it's also taking the time to make sure you did everything correctly.
Right.
Because I know a few years ago at the state level, there was some, misreporting or mistakes. So that part of the work is the process. And I think where I get curious about is the time between, before it gets to, what are the processes in place before it's released to, the folks who are contracted to do sorry, I'm losing my words, but yes,
so I think it'll be a little more recent, because I know we're looking at 2020 cases. It's not 2024, but it is a little bit more. So you'll see more up-to-date data in this next report. Okay, the team is working very hard.
Yes.
I'm sure.
And working with the state constantly to make sure that if there is no lag time this time. So, but it is. I think that people really don't think about it. I myself have had to do some of the redacting, and just looking at the stories as you're reading what happened to her, you're just like, oh my God. So it is mentally, it can be draining on the team as well, and trying to make sure that, because we know everybody's looking for the report, and you don't want to be the part that oh, y'all didn't get it in. You know what I'm saying? Oh, y'all didn't do what y'all supposed to do. So it does kind of. But just know, I think the data will be a little more recent, because I know we're working right now on the 2020 cases. Okay. And so a lot of times there's a lot of them, and so taking out the time to say, was this pregnancy related or was it not? So it's a lot of steps in between. Yeah. And so I think people think you can just push a button and crank out the data. It's not.
Yeah.
as simple. And we have to know COVID did have an effect on some of the numbers.
Yeah.
And on the workers who are reviewing the cases.
True. Right. Okay. And so, is it this September? Is this the year for it to be? Okay, not 2025, but 2024. Yeah. Okay. Well, that's good to know. Yeah. That's good. Okay, thank you for the clarification.
Yes.
So I think you covered this. We talked about, I think you've covered this one. Or let's talk about maybe why are Black women 3 times more likely to die from issues related to childbirth than you, as you matched up to compared to white women? What are some of the ways?
Well, I think that sometimes we come into the situation in poor health. So that's one look at it. And then just imagine you're already in poor health and then you access a poor healthcare system, right? And then, but we ultimately, if we really want to be truthful, racism. And so it's ultimately the underlying. So we went from slavery, we went to Jim Crow, and most of our lives we've been in an oppressive state. And so we know that. So outside of, let's just lay that out, for racism, and then we look at some of us are just in poor health before pregnancy. And so then we access this healthcare system that is just not seeing us, not treating us like we think that we should be treated, right? And so the quality of our healthcare, and then also some of us just come from environments that are just, rough. They've just had a rough start in life, and just thinking about those things. And those are some of the things that we do see in the as we're looking at the cases. It's just because we do get previous pregnancies and things like that, and you're just looking at like, man, you as you're redacting, you kind of put a picture, you try to think of what she looks like to humanize her. And so just thinking of those 3 things that we know show up.
Did you want to add anything, Dr. Brown?
Yeah, I agree. I think, when we talk about structural racism or systemic racism and how it's baked into our lives before, as our reproductive system is developing, right? And the impact that it has on that. And, to Misty's point with entering into pregnancy and the state of our health. And, one of the things we know is that within the last 10 years, reproductive age women we're seeing more chronic health conditions, and that's among all women. But of course, with Black women, we're seeing even higher rates. So it's the health before any potential pregnancy that is also like contributing to those to that increased risk.
And by poor health, sometimes physically. What about mentally?
Oh yeah, definitely. Mental health is not managed, along with any chronic disease. And we often talk about chronic disease, but we don't talk about sexually transmitted infections and diseases. Yeah. Oftentimes we see people don't know that they have them until their first prenatal visit. And so what we're trying to do is manage all of these things in 40 weeks. Wow. Right. And so you can't do that. Some of it you have to, and then you're like, well, which one do I manage? When you go to your first visit, you need to do this, you need to eat healthy, you need to exercise, oh, you need to see a therapist, oh, you need to do this. So she okay,
right.
Where do I start? What I'm saying? So what do I have access to? You're saying, and then sometimes they're labeled as non-compliant, which I just wish we wouldn't use that word, but why you say I'm non-compliant when you told me to eat healthy, but the grocery store is so far away and I can't get there, and I have a little one and you want me to put her on the bus, you want me to wait an hour, things like that. Also, just thinking about how the healthcare system is an 8 to 5 system. I got to go to work, so I can't take off work. I don't have PTO. So if I miss a day, it really helps, and then my electric bill is due. So just thinking of all the factors, and so we think that they're non-compliant, but some things they just can't do. Right. They just are like, okay, where? So I think starting them where they are and creating these small wins for them.
Yeah.
And if I could add to that, I think, there's like that population of women, but then even if you think about maybe women who are in higher paid jobs, well, can I take off? Like, you have the ability, maybe the flexibility on paper to take off, but the workload, right? And then with inflation, right? Can I afford a whole paycheck, Whole Foods, whole paycheck, to get, your growth. So it's like it affects everybody at every level in different ways. And I think that's especially important when we're talking about Black women, is that, you know, because I know Misty and I talk about this a lot. It's not just Medicaid. It's not, and we were just having a conversation about like private insurance and what certain rates look like for those who even have private insurance. So I think that's really important for people to like know and think about.
Now, I'm glad you said that. I was going to go there next. I think sometimes we also have to make sure people know that when it comes to Black women and maternal health, your socioeconomic status goes out the window, right? That it could happen to anyone. And so I always use Beyonce and Serena Williams as my kind of bitch to say, if the two of them had to fight not to die, I mean, those forget entertainer, athlete, just the most recognizable human beings in the world. Like, what does that mean then for the everyday folk when we go in and saying, this is how I'm feeling, I need it? Like, I saw on Instagram, they showed a nurse, a Black lady was at the doctor's office she wanted a note from the doctor because she wasn't feeling well and she needed to be off from work. And the nurse is like, well, what's wrong with you? I mean, you just don't want to go to work? You know, even, so you take that and you add that on to, I don't live in a place with food apartheid. I can't get to the food. You add on to that, I'm working the stresses of trying to manage family. Maybe I live next to a landfill. If you live in Southeast Dallas, that's a high probability. So the air quality is bad. The water is so if I buy the fresh fruit, I'm washing it in contaminated water. Right, so I think I'm glad you said that too, because we have to look at those intersections, right? It's not just, get a better healthcare system. It has to be that and all the other, as Cheryl likes to always talk about, all those social determinants of health that have to be attended to, right? And I think we have to even talk about that so that we're working all of it collectively.
And a lot of times I think that we focus on healthcare because it's easier for us to blame, if the doctors just would do this, or if we just train the medical students, but we don't think about poor housing conditions for people. Right. We don't think, and housing is hard. I mean, when we have clients that need housing, we just be like, oh, Lord, what are we going to do? I mean, you know, because it's one of the hardest things, transportation. So looking at walkable neighborhoods and things like that. And I know oftentimes we are constantly having conversation with our white counterparts and say, y'all, there is no education or there's no social economics that protect me from dying. So I am nervous. I don't care if I go for a cold. I'm like, Lord, am I finna come out this hospital, you know, or this doctor's office? Or I have my blood pressure's up. Because I'm already guarded. So when you go in there, you have high blood pressure. You know, and having to really talk myself down before I even go and sit in front of because you just don't know what's going to happen. That's right.
And so I think, and I'm going to say this, and it's because it's something I'm very intentional about, all of my healthcare providers, dentists, gynecologists, esthetician, dermatologist, like, if somebody has to do anything with my well-being, I really try to make sure that they are a Black person. But I'm also going to check them, too, though, to make sure you are showing up the way you ought to show up. Maybe you don't call it, but do you understand what it means to move in Ubuntu or Sawubona, that you see me beyond the physical, right? Like, I'm going to check you out. But can you talk to how that also could be a factor in securing maybe better care in the healthcare system?
Yeah, there was an article at one time it came out and said, Black women have better outcomes when they are seen by a Black physician. But then later it was published that all people have better outcomes when they're seen by Black professionals. And I think it's just our culture. That's how we are. We're nurturers. We want everybody to be well. We're the most inviting culture around. So I think that plays into it.
Yeah, I think it's out. Well, it's just me. Y'all know. I think it's also something in our DNA that there's something about we understand what it means to be human, right? And that we have not participated to a degree in systems and institutions that place a value gap, as Dr. Eddie Glaude would say, on humans. So if you come in, I don't have that automatic, you're less than me. If there's some social hierarchy, and your station in life determines how I see you and how I treat you. Yeah. You know, and I think that's part of what's at play when that happens, right?
Yeah. I think, too, I agree. I think there's also like kind of, I guess, us also being aware that, and this is not to, well, I'll just say, so I think that level of like intentionality and being well-meaning with providing care is there, but I think there's also the reality that many Black physicians are also trained within a system that is inherently racist. And I say that because like even, and it's just like personal. I know we've had different experiences too where, you know, I've had a Black provider who I'm trying to go get a colonoscopy and you telling me I'm too young, but I'm telling you I have a family history and, or, you know, I want to get my fertility checked but you're telling me, oh, don't worry, you know, so knowing that it's not always blanket, but like both of y'all are saying is that, you know, you have your Black provider, but you also check them, check those biases that they may have, that we all have, right? We all are embedded in bias in different ways, but just not going into it maybe blindly of, okay, check mark, Black provider, I'm taken care of, but like that step further.
Yeah, I check everybody, even if they come into work in any kind of movement. I'm gonna check you out.
Yeah, you have to.
I mean, we saw it on the national level, televised. Dr. Jackie, that clip that she made before the movement of Black Health, even though we were all working in it, but for whatever reason, and the Black community came and checked you, like, what?
Oh
like,
yeah, she caught it.
Yeah. And I think even though it's so, even in the last season, she had to address it again, like, and apologize to what she said, and so you were taken back, like, now what? Like, but she even said some things that were not in alignment, and so
it was and it was reckless because for people who already think that way, because she don't see the damage that does to everyday Black folks who got to walk into these doctors' offices, right? Because then for them they're like, well, even a Black woman is saying it.
And then that was just such a like that was one of the most harmful
I couldn't believe
stereotypes like of any like that one
out of all this is what you put out there. I mean, and said it like with so much force too, right? Like
conviction.
Like y'all need to know this public service announcement. I'm like, did she just say? I was like, okay. But I was glad to see people like really going, really checking her in a way to say, this is why it's so harmful for you to say that. And I think as much as she apologized, they're like, yo, we're good. Because you just, to say that, that's just, better. And so.
But I think that also you got to check her tribe. Because she should have apologized way before the Twitter, Twitter said something like her. They should have been like, "Now, sis," And that's what I love about our relationship because she gonna check me now, Misty, and I'll be like, "Okay, girl," or you went too far. Okay, girl, or I'll call her and say, "Okay, this is what happened," or "This is what I'm feeling." So we don't have this. Yes, we do have the rooting for you, but she also gonna check me, and be like, "Now you shouldn't have said that in front of white people." Or you know what I'm saying? Or I'm just we said we're keeping it real on the show, but okay.
Classroom. That's how she would say it. Fannie would tell you straight up.
Yeah.
But I think that's important too. So let's talk about that because the show is like create a circle of care for Black mothers, right? But I think we call them, sister circles, for example. To your point, and the importance of that, even for even maybe childbearing age women who want to give birth, like how do we, before they even get pregnant, how do we make sure we do everything on the front end? So to your point, when they do get pregnant, you've reduced the likelihood because maybe you've attended to your mental health, you've seen a therapist, you're mentally in a good place. If you have some kind of medical things that need to be attended to, you deal with that. But and how do we have where we hold each other accountable even in that way, right? Or even if you get pregnant, how do we circle around you during that moment? Not just family, but a real circle. When the baby's here, let me come bring you some food, right? Or you need some, let me get Molly Maid. I don't know, they have Molly Maid in Texas.
Yeah.
Okay. Tell Molly Maid to come by and clean the house. I mean, just how do we ahead of time begin to think forward thinking about family planning? Like think those things all the way through, knowing what we're up against, not just the healthcare system, but also a society that is structured based on where you live in a city, access to life-giving, life-sustaining resources.
I think we got to open our mouth and talk. I mean, a lot of times we be like, don't say this, don't tell this is going on. And so we don't get the help that we need until it's too late, because we keep sweeping it under the rug until the rug is so high, and if somebody walk in like, now what's going on here, But I think we have to have honest conversations in our community, and I think a lot of times we don't, especially when it comes to reproductive health. A lot of people struggle with that because people think that, oh, you're just giving them the okay to have sex. Oh, you're just, you just want them to be okay with having an abortion. So there's so many misconceptions when we talk about this reproductive health portion, and having so many, they don't understand it. And even no matter how we present and we go and we talk, it's always somebody be like, oh, I didn't know that.
Right.
And we're like, what? And so just having these open conversations and creating it for the women of childbearing age to be able to go to anybody and be like, this is what I'm thinking about. This is how I'm feeling. Because we also go on the end, well, it was unintended, and we stay there. But okay, it's happened now. So what do we need to do to circle around her so that she can have a great birthing experience?
Yeah. So Dr. Brown, why don't you tell us, because you said the word, and I want to make sure people also know what that means, reproductive health. Because unfortunately, in a lot of our communities, and particularly a lot of Black faith communities in the Deep South, when they hear that, to your point, it's all about abortion and, birth control. Y'all going to have these young girls out here having sex.
Yeah.
So let's really talk about, when we say reproductive health, what that really means. I mean, we've talked about it in a roundabout way, but just so people, when they hear it next time, they know, oh, this is what it means. And particularly in this upcoming election season, where I imagine they'll recycle some of that same narratives around why we have to have total abortion bans, and saying reproductive health has to be go away, and they're only attaching it to that, and how people thinking about it in a very narrow way. So maybe you can talk to us about that.
Yeah, I mean, when we talk about just reproductive health plainly, it applies to everybody. Anybody who has working organs in some way, regardless of your birth sex or gender or whatever, reproductive health applies to you. So prostate health,
That's it.
Cervical health, is so all encompassing. And I think maybe for those who may think about other things, just think about, your basic sex organs and internally, right? So if you have a vagina, if you have a penis, if you have, ovaries or not, like all of that encompasses reproductive health. And when we kind of move into reproductive justice, building on that, we're talking about the right to govern yourself and your organs, whatever they may be, however they may be functioning, and to have optimal health in that regard, just as we would want optimal heart health, just as we would want optimal oral health, whatever, right? It's all integrated. But the right to be able to govern that, and the right to be able to choose how you do that for yourself, not Cheryl, not Misty, for yourself.
Right.
Right. And should you, do become pregnant, whether it's intended or not, having the right to parent safely, right?
Yes.
And to parent in a safe and sustainable environment. So, that just further kind of builds on it. But just knowing that reproductive health is health, just as oral health and eye health and heart health is to the human body.
Yeah. Thank you for that. That's what people need to hear. So when they start hearing these other narratives, they have an understanding when you hear that this is what this means. And to your point, that it's individual decision.
Yeah.
Right. This is where you can be individualistic, right? Where you can have agency over your own body, right? And what that means. So let me ask this. I read something last night, so I said I'm going to ask them today, because I don't know. This is not my area, my field. But I was reading something that said what we don't talk about often is the father's health. And that the father's genes also help in creating the placenta, which we know is essential to the fetus because it provides the nutrients and the oxygen. So let's talk about that. Let's talk about
sperm health, is reproductive health.
Come on now, let's talk. So let's talk. But I know we're talking about, but you can't disconnect that from what we're talking about. What can lead to preeclampsia, right? Hemorrhaging, bleeding out. So let's talk about that. The men, what the men outside of being co-conspirators and also lifting this issue up, what is their responsibility personally to improve the maternal health of Black women?
I'll just say, especially from like physical health standpoint and the contribution to the quality of the sperm and how that, leads to the quality of the embryo and the fetus is equally important. So that doesn't mean that, okay, well, I'm going to be in support of women's health, go ahead, right, but not take care of myself, especially before I even think about wanting to become a parent. Because the point is, that's why I say potential parenthood or potential pregnancy, because you never know. Hey. Right? 50% of pregnancies are unplanned, right? So you just never know.
What?
Yeah.
50%? Yeah.
Mm-hmm.
Okay.
Yeah. We out here.
Yeah,
so, so it's like, men also have a role to play in their own health and ensuring that, but can also be supportive of, their partners and having that mutual accountability.
Yes.
For sure. And I also say that's physical health. So that's your heart health. That's your reproductive health, getting what you need to get checked, right?
Right.
And I think that's probably a whole nother podcast about stigmas related to men's reproductive health, prostate health, all of that.
Yes.
But also the mental health side of things, just as it would be for, myself as, a pregnant person. So that's what I'll add to that. And
only thing I would add is mental health as well. Because, he needs to be physically, but mentally he has to be there as well. But we've often talked about this family unit, whatever it looks like for individuals or birthing people. And if you're in the maternal health world, we started out, we were just focusing on the infant. Okay, if we could just get the infant here.
Right.
And then we said, no, we're forgetting about the mother. So then that's how we became the maternal and child health. And now there's this conversation. It needs to change because we're leaving the father out. Even when we talk about our discipline and our work, we say, I'm in maternal and child health. So where does the father or his partner see himself or herself in that space? And so I think, and then also talking like we've seen fathers go and want to be an active part in this, and the doctor only looks at the mother. Like he's not even there. Or in the birthing room, they only focus on the females that's in the room and they like, well, what about me?
Yeah.
But we've seen that if Charles Johnson hadn't been really advocating, even though they had an adverse outcome for his wife, but he was there really advocating and really he had really known what was already going on with the pregnancy. So we want to encourage it, but we also have a system that needs to embrace it as well.
For sure.
And so while he's checking his health and getting himself healthy and getting ready, and while we in the church, since we're here in the church, we often say preparing them to be deacons and ministers and all this kind of stuff. Well, we'll prepare them in other ways, talk about their physical health and their mental health.
That's
you know what I'm saying?
That's right.
And so, as we're building them up in this ministry world, and so because I know that's where they would listen the most, right? And so while we're over here building her, we need to build together.
So I made a note. Next, we're going to do an episode on Black men and their reproductive health.
Yes.
Okay. We're going to do that. I already made a notation because that would be a good conversation to have and very important conversation to have. Because even I have been recently when I'm telling the brother, y'all need to be a part of what we're doing. We need your voice. And I never thought to say, because you too are, my thing is more you need to be a supporter, but now I'm going to shift my conversation to say you are just as responsible.
Right.
For your equal partners, right, in this, because oftentimes when that does happen, I think people tend to look at, well, what did the mother do? What happened to the mother? Not thinking about, well, did something of the father's genes impact, right, the ability of her to survive? So I think it's important to kind of bring them in, not just be like an ally or co-conspirator, but say, no, you are part of it.
Right.
So that's good.
And I would just add to that list of things in that, it's your contribution to the infant, but it's also your contribution to the partnership, whatever that looks like. Right. Because, if you're not taking care of yourself and you having cardiovascular issues, and what strain does that put on, on you? We can't have you, right, stroking out at 35, right? And so it's that side of it too, because you are a contributor to that family unit, whatever that unit looks like.
Whatever it looks like, you are still a part of it. That's really good. Thank you for that. And I just happened to run across that last night. I was reading something. It was just speaking to the fact that we leave the men out of the conversation, and that they're very much a part of what even builds the woman to even be pregnant. And then like they were breaking down like how the genes impact the placenta. And I'm like, well, you may not. She's carrying, but you are too.
Yeah.
And how they begin to see the connection. And I like how you said, I think. And in faith spaces, we definitely do better with that, because I think, depending on where you are, not here, we tend to be a more progressive church. But in a lot of churches, though, it's still a matter of she's pregnant, that's the women's thing to manage and deal with. Yeah. So we have to even shift our minds, even how we think about that, and have them think about their health in a different way. Mm. So, we're going to have to put, that should be a good one. That should be Look, baby, look, on all levels. But that's another show too.
It sure is.
Yeah.
That's a whole other show. But I'm still stuck on 50% are unintended. Okay.
And 50% are planned,
Yeah,
But
I guess, and this just in my mind, and, so y'all can be like, now, Danielle, you can feel free to check me too. Because I'm thinking, well, now, because I always think, oops, I didn't know I was going to get pregnant. I'm thinking, well, did you use any kind of birth control? Or did you take any? Well, no. I'm like, well, I mean.
Well, I think.
So help me understand what unintended means.
So we're not filtering out relationship type, right? That's just among all people. So whether it was a situationship, a relationship, one night, or marriage, and that just wasn't planned. And so it can hit on all of those kind of situations. And so if we kind of put everybody in that pot,
I see. That can make. Thank you. That makes the number. Thank you. I understand. It makes the numbers go up.
Yeah,
especially in situationships. Like, oops.
So if you're not intentionally like, we're gonna be scheduling and we're gonna, all of that.
Right.
I mean, just think about your own tribe. How many of y'all sitting around saying, "Girl, I'm gonna have a baby in a year, but I got to get this in order, that in order." It's not really. We ain't sipping on our wine and talking about, "Girl, help me plan out this pregnancy." It just happens, and then we say, "Oh, y'all,
oops, yeah,
and we like, who the daddy?" You know what I'm saying? You know what I'm saying? What those are like real live. We see this, and we be like, "Now what?"
I've only met a small few. There was a person I knew, and she had her and her husband had a calendar. Oh, and they're like, they were serious
tonight,
about that thing. This tonight.
Okay,
but there's very few people.
Very few. Okay, yeah. I was like, but now you ask. See, thank you. That makes a lot of sense. Because I know people who's like, oops. I didn't know the number was that high. I think that's what I'm saying, like half and half, right? So let's talk a bit about I think sometimes people also know what can I do? Because it is a big issue, and it's a lot of entry points. And we mentioned it's not just the healthcare system, right? So what are just some things that people might want to do if you want to say something to someone on an individual level, if they're listening, and they're thinking, oh, wow, I didn't know that. I didn't know that Black women more disproportionately are impacted by the healthcare. What's like one thing you would, well, before I go there, because I want to bring this up, we didn't talk about this, doulas and midwives. I'm reading a book now called Safe in the Midwife's Hands, and it kind of chronicles the history of Black women who have safely delivered the children, but it's not just delivery, it's also post-delivery. Like, how do we look beyond just the child is here, but how do we care for the mother beyond that moment? So maybe first let's talk about how doulas and midwives can also be a part of improving that, and then that's just kind of, then we'll talk about maybe more the things we can do just as a community, but and what doulas and midwives do, so people are clear.
Well, I think with doulas, so some are full spectrum doulas. So they do, they're there during the birth, prenatally, and all of those things. Then there's postpartum doulas that come in after she has the baby. And then, midwives, as we know now, most of them are now certified midwives, and we see some of them. We do have some still out in the community, but some are certified now. So if we talk about history and look at what happened, we were midwives. and now they put an education and certification on it. So now they're certified nurse midwives. And so looking at that history of how that's kind of X some of us out.
Right.
You know, but they, I digress. So they do great work, and they do focus on the different stages of the pregnancy and of the, whether she's postpartum, whether she's in prenatal. And so we know that prenatally doulas, they really support them. They advocate for them. They educate. They help them through this process. And then when they go into the postpartum, they are there to help her, like, to do things that maybe her family is not there to do. So we see they still are educating, they still are advocating, but they may take the baby and hold the baby for a little while so she can go and sleep. Or they may do some light housework, you know, so let me wash these dishes for you, you know, so things like that is what they typically do. And then, as I said, midwives, if they're not out in the community, they most are in the healthcare system.
Okay.
And I know that, like with a lot of the research that's coming out, we know that, especially with doulas, the impact of doulas on, sorry, no, I hear myself breaking up, the impact of doulas on, like, you know, later outcomes, whether it's mental health, or just better, like breastfeeding initiation, you know, things like that matter with that parent-infant bonding, and just general well-being.
Okay, yeah, because I just want people to also, because I know people hear that now. You know, language definitions are important. So people be clear about what that is. Particularly, I know I'm hoping that we have the bill coming back up again next session around funding, having a law that helps provide funding for women to access doulas. I know that didn't make it last time out of session. So people hear that, and we're saying, hey, we want you to pick up the phone, to call this legislator, to testify for a committee. Like, they know what that means. So it's, ooh, I don't know what that, well, this is why it's important.
Right.
And here's what they do, the value they add to.
So I think, go ahead.
I was gonna say, and I think that's the HB 465, like the pilot that with Medicaid in Texas, but that doesn't just impact the birthing person. So like next week we have a webinar with Black men for reproductive well-being and justice, and we have a dad doula, right? So even, you know, the men in the partnership can have access to a doula, a male doula, who's there to support them.
That's good. Oh,
you know,
yes, that's awesome.
And educate them on how to, you know, navigate through this journey.
Yeah. So. And you brought that up. I'm gonna try to shout this out as much as I can so we can see what's possible, so we can push for more. With Representative Tony Rose being able to author and able to get HB 12 signed into law that extends the coverage, you know, from 2 months to 12 months, which is critical and important. But now we got to look at implementation and all that. But the idea that we have to push for these kind of things while you do the important work you do, right? The work you're doing internally, you know, institutionally. Like, we also have to set up and as we do the day-to-day care, like as we see like the AFIA Center and others doing that important on the ground, grassroots, in community care, we still have to look at how we make these structures more equitable.
Yes.
So go ahead, Misty, you want to say
So
something?
I think that also we love the House bills. We love that we're starting to hear doula language in our legislative sessions. But what we often remember is that what we forget is the language that's put in the bill. So we'll say, you can get this doula paid for, and the doula could be reimbursed, but if she does case management. So we have to work with the doulas to say, okay, what does this look like? Because we know that doulas don't do case management,
right?
In theory, like we define how. And so I think that the bill was exciting, but how is it practical for our doulas, our current, you know, because they're like, okay, well, what does that mean? I do case management. So what you'll see is that the doulas that may be connected to like a MCO, a managed care organization, they do case management, but they have the doula title, so they can be reimbursed for that. So we have to start thinking about that language and working with our representatives to say, okay, this language is not equitable for all. Because I want to be an entrepreneur because I don't want to be tied to this system. And so it leaves out the doulas that have their own businesses. And so we have to work with the language that's in the bills as well.
I'm glad you said that, because that's important. And so since it didn't pass, maybe perhaps it's something that can be done to who, I'm not sure who authored the bill. Do you know who authored the bill? I don't know who authored the bill.
I don't remember the name of the
But
person.
I'm glad, but that's important to know. I didn't know that about that. I just knew it didn't make it out. And, my first reaction when certain things don't make it out has more to more to do with who's down there than, language. But that's important because we would need to change that, right? Because I think that's just something very critical, important to make accessible to those who may not have much, the resources to do so, right? That we're trying to make sure everybody can have great outcomes, not just because you may have the financial resources, but to everyone.
Right.
So as always, time flies.
I know,
We're in the-
already?
Yes. So we only have 5 minutes left, so I want to make sure that I'm able to talk about what's getting ready to happen because I didn't even mention this starting today.
Yay,
This is Black Maternal Health Awareness Week.
Yes.
7 days, you'll be seeing things really around the country. You'll probably see a lot of things on social media, different organizations really talking about Black maternal health in many ways. But with Kyrah and Misty and many others in the community, there are a lot of events that are going to be taking place. You have an opportunity. Here's what you can do individually or as a faith community, because as a faith community, we're going to support some of the activities. So, Brooke, can we put that up? This is going to be Black Maternal Health Week. And so I don't know if everybody can see what's listed, but Misty, Kyrah, you want to point out maybe a few things from the 11th through the 17th? What people may want to, some ideas of what people may want to engage in.
Sure. So tonight, actually, there's going to be 2 aftershock viewings. One of the co-organizers was United Way of Metropolitan Dallas, and so they're hosting that aftershock viewing at UT Dallas. There's also another viewing on UTA's campus tonight. And then Friday, we're having the maternal health mixer at Hotel Dryas in Fort Worth. And then on
Saturday,
13th.
Saturday we're doing What About Our Faith, a conversation on Black maternal health at one of the local churches in Fort Worth. And then Sunday, we will have a D9 family reunion community shower. So we're asking all D9 and non-D9 to come and bring items for the mother and the baby, and we'll just have a good time. And the what we're thinking about behind this is that, as we talked in this show, is that way we can be around college-educated people who are affected the most.
Yeah.
And so that we can
That's
bring
good.
this conversation to all of these college-educated people, say, it's not the low socioeconomic, it's us. And so that's one thing. And then on the 15th?
On the 15th, we're having a stats and snacks. So we're bringing in 4 different researchers that are leveraging reproductive justice in their work and how that connects to the larger movement.
And on the 16th, we're going to focus on the 4th quarter, which we will talk about what happens in the 4th trimester. So we have a Black psychologist and we have a Black OBGYN that will be with us. And the whole premise is to merge the two, that she's talking about what happens with the pregnancy, and this happens with the mental health of the patient in the fourth trimester, So that's what we're talking about. And then on the 17th?
On the 17th, we have a webinar that's going to be at 5:30. We're featuring 3 men. One's a doula, one's works on fatherhood, Black fatherhood, and the other also fatherhood and also doula work, and talking about the role of Black men in reproductive well-being and justice.
So there you have it. A lot of great info. You can learn everything you need to know about Black maternal health during this week. Definitely, I know you will find things throughout social media. Folks will be, we'll have some things posted as well as what was just listed. And where could people maybe find this flyer? We have it here, but where is it UTA?
Either Googling any of the organizations on here, like on Instagram, but we do have UTA is hosting a site where we've been adding these events as well as other local events as well, just to uplift others too. But if you go to MCH Equity Lab, UTA, you'll see an events page for 2024 Black Maternal Health Week, and you'll see other events.
Nice. So make sure you check that out and attend something. You can't attend everything. I know I'm going to try to hit up a few of these, but attend something to increase your IQ around Black maternal health and how you can be a part of this movement that many people have been doing for years, but certainly as more of us need to be involved in this movement and lending our own resources, talents, whatever we may have to be a solution to it. So thank you, Kyrah. Thank you, Misty, for being with us on
Thank
today.
you.
It went fast as always. So
It
thank you for
did.
being here. We want to give them a clap, Brooke. We thank you for all you had to share this day. So listen, make sure tell your friends and your families to like us on Instagram, like us on Facebook, subscribe to our YouTube channel, and make sure you hit the notification bell so you can be alerted when we go live every Thursday, 12 o'clock noon. And of course, as I always say, we bring amazing guests and we want to keep the classroom going. So one way you can support us, if you're not watching on your phone, you can scan the QR code and you can purchase your Fannie Lou Classroom t-shirt. If you're watching on your phone, you can go to friendshipwest.org/justice and you will see a link where you can purchase your Fannie Lou Classroom t-shirt. And then next week, make sure you come back. We're going to have another great episode. And one of the things we're going to talk about, it falls in and out of the news based on news cycles, but we remember what's happening at the Texas-Mexico border. And more importantly, we always want to make sure we talk about those in the diaspora who are finding their way here to Texas, the Nigerians, Ghanaians, Haitians, you name so many are there, and we have been there several times and interacted with them. And I can tell you that yes, even in the migrant community, there's hierarchy. Even in the migrant community, there's racism toward darker skinned migrants and how they are treated not only by the U.S. government, but also by some of those non-governmental organizations, nonprofits on the ground claiming to help. And so what we want to do next week, we're going to bring Anira Cano and Stephen Reeves, who have been at the border, continue to be there, providing resources and being intentional about making sure that all migrants are attended to in a fair and just way. So it's important for us to have this conversation around not only immigration policy, but also what we need to do to make sure that those migrants who are darker skinned are getting what they need in a timely fashion and being treated as such, that they've been through so much to even make it to the border. And we'll talk more in detail about the treacherous, dangerous pathways that many of them travel to get there. And we want to make sure that their humanity is left intact. They already have so much along the way, and we don't want to experience it even more when they think they finally made it to a safe place. So we'll have conversation around that on what you can do specifically, but we'll also talk about immigration policy as well. So join us next week, 12 o'clock noon, here in the classroom.
From the church house.